From politics, let's get into matters healthcare, and communication between the deaf community and public healthcare providers has received a boost following the launch of an app that provides real-time sign language interpretation services. Health stakeholders attending the launch of the app in Nairobi hailed it for bridging the communication gap, calling for more technology-driven investments towards assisting persons with disability access health services.
Imagine being deaf, walking into a hospital with an emergency, but you have no way of communicating with the health provider who barely understands sign language.
A deaf person is supposed to travel probably from Kayole, right, to Mama Lucy. And the interpreter might not necessarily be living in Nairobi. The emergency then will stop being an emergency. He will just be going to address a situation that has arisen.
This is the harsh reality facing the deaf community when seeking health services at public health facilities.
One, the barrier in communication. Again, we are not able to really understand how the patient is feeling. And you know, for you to treat any patient, you must get history. And history is important, especially if it comes from the primary patient. That is the patient himself, not someone else explaining.
It is perhaps this gap that health stakeholders sought to fix with the launch of an app that is designed to conduct real-time interpretation services dubbed Assist All.
The lack of and the logistical challenge of a sign language interpreter going to offer that service live is actually reduced to almost negligible. The challenges are reduced to negligible amounts by actually having this interpreter on the virtual space.
Because we've been trained how to use, you just log in, then when you have a patient, now you call the interpreter, and then they will be able to bridge the gap between the medical officer or the medical practitioner and the patient.
Speaking during the launch of the program at the Kenya Institute of Special Education in Nairobi, Luke Muleka said the mobile application will be piloted across all level 4 in 5 hospitals in Nairobi in a bid to enhance universal, inclusive and equitable healthcare in the country.
The app is able, as you dial, a free dialing on through the wallet of the Nairobi County government. There is a payment to the app, because if you are going in as a regular customer, you pay 30 shillings a minute, but it's broken down to per second billing.
We really appreciate if they could have more of assistive devices to help us help our patients.
John Kahiro for Prime Edition.